Good afternoon, everyone, and welcome to Life Clinic with Dr. Chris. You know, Life Clinic was a seed. Life Clinic was a vision that Yahweh gave me before I ever started to do the level of public health advocacy that I'm doing right now around this pandemic. And I find Life Clinic as a very important tool to engage with hopefully thousands upon hundreds of thousands and evenly ultimately upon millions and millions of you. So today we're going to talk about a very, very, very important topic. We're going to talk about coronavirus, or you may have heard it described as COVID-19. Basically what that COVID-19 is, coronavirus disease 2019. And so we're going to break down the myths. We're going to break down the misinformation. We're going to break down the disinformation, people purposefully putting out things that are not true or lies, so that you can operate in your self-efficacy. What is self-efficacy? The ability to make an informed choice or decision. That's what I am here to do today. I'm here to help you along your decision journey. I am at heart a connector. I love connecting with people. My mother cultivated that dream, that vision, that skill, that anointing within me, even when I was in her womb. Bless her name, Merlene Gregory Purnell, who is in heaven approximately 3 years ago. But today is in honor of my dad. Today would be my father's 79th birthday. Big Tim. Hold tight, hold tight, hold tight, as he would say. And I lost my father on April 13th, 2020 to the coronavirus pandemic. I will say a little bit more about his story in a few moments, as well as I will say something about the stories of all of my family members who have been impacted by this catastrophic public health crisis. But I thought no better way to honor my dad, no better way to honor the research scientist he was, to honor the justice advocate that he was, to honor the racial equity advocate that he was, than to do a life clinic on his birthday. So thank you for helping me to remember him, and thank you for helping me to pay his legacy forward. So today, I'm actually going to use slides. I know you may be thinking, is this a lecture? But I think the slides will be helpful. I'll go back and forth between slides and just talking to you like I'm talking to you right now. If you have questions, please feel free, write your questions in the comment section. I will have someone post those questions so that I'm able to see them in real time. I'll try to weave them in as I'm speaking, or if I don't get to it, once I'm done with the presentation, I'll take pauses and I'll say, does anyone have any questions? Okay, so what I'm getting ready to do, I'm going to share my screen. I know, I have a lot on my screen. Okay, so hopefully everyone is seeing Life Clinic with Dr. Chris. That is me. Just to tell you a little bit more about myself, I am a board certified preventive medicine and public health physician. You may be wondering, what is that? So I am a doctor, as I like to tell people, I treat systems. I don't do direct patient care. So I don't see patients in a one-on-one encounter or occasion, but I think about groups, I think about populations, whether those are patient populations that we treat in a hospital, or whether those are populations across communities, across neighborhoods, across cities, across states, across nations, across geographic regions. So I look at populations and I look at the distribution or the disease prevalence of certain conditions and the factors that contribute to that distribution or that pattern of illness or that pattern of health and well-being. And I really, really, really try to dig down and to diagnose what in the system, what factors, what structural determinants, what social determinants of health, or what community foundations of health, all of these words that you may have or may have heard of before. But that's what I do as a preventive medicine and public health physician. I treat the system. And so I very much focus on health equity. I very much focus on community-based advocacy, and I very much focus on health justice. And in doing those things, I focus on racial equity, because you cannot achieve public health goals without looking at how racism, which is a public health crisis in and of itself, how that system, how the system of systemic racism or institutional racism, and I'll define that, has impacted health outcomes and has very much determined and influenced how we see the pandemic unfolding in our nation more broadly. And so also I am a fellow of the American College of Preventive Medicine. So shout out to ACPM. I love being this type of physician. I thought that I was going to be a brain surgeon until standing on that wall and that Neural Path conference at UCLA, the Holy Spirit dropped something in my belly, in my gut, and say, you were called to be something different. And that something different is what I'm doing today. So welcome to this journey. So where do we begin? I think it's so important that when we talk about coronavirus or when we talk about the COVID-19 pandemic, that we only don't speak about numbers, that we only don't speak about stats, that it's very important. If you've heard me say, if you've seen me on any of the social media posts that I've made, or perhaps some of the public appearances on broadcast or cable media, you will hear me say, follow the science, follow the data. I'm always harping on those two important things, and rightfully so, but we can't do any of that without capturing the narrative. What is the narrative? What are the stories behind those stats and numbers? And that's why I wanted to start with this graphic, so that at the end of the day, we do not lose sight of souls, the souls of Americans, the souls of people all across the globe that have been lost or that have been dramatically changed. And all of us have been impacted or infected or affected in some way. I like to describe coronavirus as a whole system illness, and that's not just the body, but that's systems in society. So it has impacted us economically, it has impacted us socially, it has impacted us medically, it has impacted every facet of life. And so that will be relevant as I describe why we see a disproportionate burden in certain historically excluded and marginalized groups like Black and Brown communities. So this is the man that we're here in honor of today. This is my dad. This is Big Tim, Daddy, as we call him, my family lovingly. This is Timothy L. Purnell Sr. He would have been 79 today. Quite a heroic man, a very heroic man. My father stared down the Jim Crow South. My father had imagined that he would be a Navy fighter pilot, but racism attempted to totally sideline his dreams. While he didn't enlist in the Navy because he was lied to until he didn't perform well on an entrance exam, when he actually performed very well, and went north like so many Blacks did, seeking economic opportunity, escaping racial terror of the South because of lynching and because of oppressive Jim Crow. He went north where he had family. He went north to the New York area. And ultimately, my father took on various jobs, always a very smart person, always had a knack for math and science. He ultimately landed at Bell Labs, the famous Bell Labs in Murray Hill, New Jersey, where the only available job to him was cutting grass. And I really want you all to listen, because someone listening today, you may say, look, I'm really good at this, or I really love to do that, but I don't see an immediate opportunity, or I don't have immediate access to that dream or that passion or that purpose. Don't give up. Let the story of my father be instructive. So ultimately, my father went from cutting grass to becoming a member of technical staff at Bell Labs without a college degree. He was self-taught, and that was a rank that was typically reserved for those who had advanced degrees, masters, and even PhD scientists. My father was a part of labs that worked on things like call waiting, three-way calling, caller ID. My father did things around crystallography and a host of other important research. But as many as his friends at the lab would say, one of the most important things that my dad did was to advocate and was to fight for others to get into the field of laboratory sciences. So that's my father. So I lost him on April 13th, 78-year-old man, multiple chronic health conditions, and that will be important as I talk about how risky the pandemic has been for certain groups and why that is so. My father was hospitalized at a local hospital, and many of you have heard me describe this, at a hospital nearly 4 miles away from where I work. My father lived for about 2 weeks with coronavirus. He didn't go into the hospital sick with coronavirus, but got exposed at the very, very, very beginning of the pandemic. I tell people, while New York and New Jersey were the epicenter of the pandemic in the spring of 2020, that epicenter personally landed on me in losing my dad and the other lives in my family that have been affected. So that's Big Tim. We'll continue to weave back and talk about his story. And I think it's also important that you know about my sister. This is my sister, Kim Maria Walker. My sister is a hero in my family. My sister is a breast cancer survivor. That piece of information is important. My sister was also working on the front lines, an essential worker, working in a large retail chain. And got exposed to the coronavirus very early on, likewise in the pandemic. And my sister is what we describe as a long hauler. So you will hear me talk about the risk associated with coronavirus, and I will compare the risk of contracting coronavirus, being hospitalized from coronavirus, dying unfortunately from coronavirus, with the risk of having long-term effects of coronavirus, and weigh that against any risk associated with adverse outcomes or adverse reactions from the 2 coronavirus vaccines, which have currently been approved under the FDA's emergency use authorization. So my sister is a long hauler. Okay, so remember that, and we will return into that. I also have to talk about my cousins. I lost 2 cousins to this pandemic. I lost my beloved cousin, Thomas Franklin Boswell. We called him Frankie. He is who you see is to my left, and with his son, Frankie, with the hearts. We lost him around Thanksgiving. He died because of complications of coronavirus. He too was an essential worker, a postal worker, right in Newark, New Jersey. His route went by Wiggins until his route got reassigned, and his route was in downtown Newark. And he had a catastrophic stroke from which he was never able to recover. And he also had blood clots in his lung. I think it's important that you know about his story, because this will go into risk. My cousin was at first assumed to be treated for a URI, an upper respiratory infection. My cousin had been on antibiotics. The Saturday before my cousin was hospitalized, and I'm sharing this story with the permission of his son and his family. He had been roving the city looking for a place to get tested. And he ultimately got tested, but that proves to be too late. He ultimately lost his life. And it's very, very important, these details, because we'll weave these in. And also to the right, you see another beloved cousin of mine, William Boswell Jr. He too lost his life due to coronavirus. And at one point, appeared maybe to be, hanging on, very long hospitalization, but ultimately succumbed to the illness. And so 31% of Black people in the United States know someone who has coronavirus. I use myself as an example. I'm one of the 31. Not only do I know someone, but I've lost 3 people, including my father, and my sister is a long hauler. When I say that coronavirus has disproportionately impacted Black and brown lives, that is what I am describing to you. But it's very important that we don't only think about how we arrived at this point, but what were the historical factors contributing to what we see in this disproportionate burden and impact, these earthquakes of devastation in our community. And as I say the names of my relatives, I say the names of those Blacks who have endured traumatic experiences at the hands of healthcare in the United States, whether we're talking about enslaved Black women, as the portrait of the painting that you see here of Lucy and Arca and Betsy, who were forced to endure gynecological surgeries at the hand, very barbaric, of Dr. Sims without anesthesia, and of course, without their consent, because their full humanity was not recognized. And that's relevant because that's going to play into what we still see today: broken trust, right? But before I focus or harp on broken trust, we also see a lack of demonstration of trustworthiness by the healthcare system, by the academic medical complex, by the scientific and research community. So we'll talk about how important it is to repair, rebuild, and to cultivate trustworthiness in order for there to be trust. I can't only talk about what happened to enslaved Black women without also talking about the infamous Tuskegee syphilis study, where approximately 400 Black men were denied withheld treatment for syphilis so that we could study, we meaning healthcare, we meaning scientific research community, could study the natural progression of the disease. You say, why is she doing this? Why is Dr. Chris going through this litany of stories? Why am I telling this narrative? Because it matters and because it's important. And if we are to get out of this pandemic, we have to understand the factors, those structural determinants, those social determinants of health, and those community foundations that are driving the very numbers, that are driving the very issues that we are dealing with. I also have to speak the name of Henrietta Lacks, a Black woman in segregated Baltimore who had metastatic cervical cancer and had tissue samples taken from her womb without her consent, without her permission. I was asked the other day in a piece, what Black women would I talk about, or would I say have a legacy through this pandemic? And I said, Henrietta Lacks. She was a scientific pioneer, but not by her own choosing, because of the tissue sample taken from her womb went on to proliferate and become one of the most productive cell lines by which we've been able to achieve, we in science have been able to achieve countless scientific and medical breakthroughs. And finally, I must say the name of Dr. Susan Moore, a Black woman physician in Indiana who lost her life not too long ago, in the past month or so, and should not have, who was sick with coronavirus, and institutional racism and systemic racism contributed to her death. And I say that without any flinching. I mean, it's important that we all understand that, so that we can begin to disrupt, dismantle, and uproot. Unless we will never be able to achieve. It will be one pandemic after the other. So the color of coronavirus. This is something, we'll place this 8 p.m. research lab link in the comments section because it's very, very important. And when I say Black and brown communities have been disproportionately impacted, this is what I'm talking about. We have seen the collision of two pandemics. That fast pandemic being the coronavirus pandemic, which I'll give you some facts around, and that slow pandemic being systemic racism. And it's the collision of those two pandemics that have caused earthquakes of devastation in Black and brown communities. So when I tell you that there is disproportionate risk of dying from coronavirus if you're Black or brown, this is what I'm describing. According to this research, which was updated as recent as the first week of January, Indigenous Americans are one in 595 have died. Black Americans, 1 in 735 has died. Pacific Islanders, 1 in 895 has died. Latinos, 1 in 1,000 has died. Whites, 1 in 1,030. And Asian Americans, 1 in 1,670 has died. Look at the differences in those rates. That's the disparity that I'm describing. Another way to say that, if I say 1 in 595 Indigenous Americans has died, that means per 100,000 people, there have been 168 deaths, okay? When we say 1 in 735 Black Americans has died, per 100,000 people, there have been 136.5 deaths. Now look at that number, and look at the number for white Americans. And you can begin to see the differences. You can begin to see the disproportionate burden, the disproportionate impact that Black and brown communities have shouldered. It's very important when we talk about risk associated with the vaccine. So you know about risk of mortality from coronavirus. I need for you to also understand risk of being infected, risk of being hospitalized. This is coming from the CDC. And the CDC compiled this data as of November 30th. And so what's very important here, the CDC will describe race and ethnicity as risk markers. I will go a step further and describe racism as the risk factor, racism as the pre-existing condition. And you may be asking, why? Why is racism the pre-existing condition? Or why are we even talking about that? Because it's relevant. Because racism, as one scholar describes, the interlocking systems of racism directly impact and influence who works which jobs, meaning access to opportunity. Okay, the service and production industries, Blacks and Browns, African Americans and Latinos comprise, according to one statistic looking at census tract data, 43% of that industry. If Blacks and Browns comprise approximately 43% of that industry, those industries were frontline industries that very much did not shut down during the height of the pandemic. Those industries are your grocery store workers. Those industries are pharmacies. Those industries are critical retail. Those industries are persons working in meat packing plants. Okay, those industries are the postal worker, like my cousin that I described, my sister who is in large chain retail. The exposure associated with working those frontline jobs, and usually because they're associated with lower wages, they have less income protections, so less ability to work from home, okay? And also, we found that those jobs had less access to PPE. So that's what I'm describing when I say racism as a pre-existing condition. Another way that racism is a pre-existing condition that's influenced the case rates that you see there, and ultimately hospitalization and death, is where people live. Right? Historically excluded and marginalized communities, poor communities, Black and Brown communities who live in parts of the cities that bear the traumatic legacy of redlining, who live in neighborhoods that have been disinvested or disenfranchised, so live usually in crowded or cramped dwellings. So not only are these people working jobs that they could not work from home, these people are working jobs that they had to work because they didn't have income protections and their households were economically vulnerable. These people are going home to crowded, usually multi-generational dwellings, meaning that if you do get coronavirus, it is near impossible to quarantine or isolate, I should say, if you have it, isolate at home. That's why it's important. That's why it's important to talk about racism as a pre-existing condition, because that has fed and fueled the pandemic, especially the disproportionate burden. So you can see these numbers. You can look across the chart, whether you are American Indian or Alaska Native, as the CDC defines Asian, Black or African American or Hispanic or Latino or Latinx, you see the differences in your case rates, anywhere from 0.6 to almost 2%, 2 times more likely, I should say, to be exposed and infected. When we talk about hospitalization, anywhere from 1.2 to 4 times more likely to be hospitalized. And again, the staggering rates around death, 1 times to 2.8 times more likely to die. These numbers are important because when we talk about the risk that are associated with the coronavirus vaccine, you have to be able to weigh the risk of exposure, the risk of being infected, the risk of being hospitalized, the risk of death, and the risk of being infected and not being able to recover. I told you my sister was a long hauler. There was a study that was done in China that looked at hospitalized coronavirus patients, just hospitalized coronavirus patients. 75% of hospitalized coronavirus patients in China still had a lingering adverse effect to their health even after recovering. So my sister's was her lungs, right? Fatigue. She had to be on supplemental oxygen for quite some time. So that's all that you need to consider when you're making your decision journey. So the first case of coronavirus confirmed in the United States in 2020, January 20th, 2020. So we're still less than a year. Doesn't mean that it wasn't around in the community. This is the first laboratory confirmed diagnosis of coronavirus. To date, we've had more than 395,000 deaths. That is staggering. That is more deaths than every world war except for World War II and the Civil War. But unfortunately, we are poised to pass the deaths in World War II. Coronavirus is tracking to be the 3rd leading cause of death, behind heart disease and cancer. That is staggering. Okay, so this is important for risk. Not only is coronavirus tracking to be the 3rd leading cause of of death, when you look at the daily death tolls, meaning that we've had days in early January where we've had more than 4,000 persons die in a day, that is more than the persons that die because of heart disease and or cancer. So in certain segments of the year and in certain age populations, coronavirus is higher than the third leading cause of death, okay? I wanted you to see this because this was published by the New York Times. It gives you a sense of what we're talking about, the prevalence, right? How many cases are out there? We have passed 23 million cases in the United States. That's mind-blowing. This has been an unprecedented public health crisis, and the fact that we have lacked a coordinated, cohesive, strategic federal response, the fact that the White House has been the largest, and this was reported in the press, that the White House, and in particular, President Donald Trump, has been the largest source of misinformation, in addition to an uneven federal response, has contributed to this staggering case, right? So that compounds your risk. When you live in a nation where you don't have all levels of government aligned, speaking the same scientific truths and facts, and you don't have resources appropriately dispatched and distributed, you get numbers like these, okay? On January 16th, we had over 200,000 cases. Right, I already quoted you the deaths. On January 16th, we had 3,353 deaths on that day. Think about that. Think about that deaths tantamount and equivalent to the deaths we experienced in 9/11. We've been having successive 9/11, successive mass casualty events, and that's the rate and the number of folks hospitalized. I want to compare this to the flu because I get this frequently. Well, the coronavirus is just like the flu. No, it's not. The next time you hear someone say that the coronavirus is just like the flu, I want you to remember that 400,000 Americans are dead. I want you to remember, and this is less than a year from the first confirmed diagnosis, I want you to also remember that coronavirus is at least the third leading cause of death. And these are the numbers of persons that have died, estimated at best from the CDC, that have died from the flu for the past successive years from 2012 through 2020, okay? So that's disinformation, and that's something you can dispel. Vaccines, so let's get into it, the heart of what we're going to talk about. There have been over 31 million doses of coronavirus that have been distributed, but shots in arms. So this number is a little bit outdated. The CDC hasn't updated, and it was important for you to see when this was updated as of. You can also see Bloomberg, and I'll show you that in a few. Bloomberg reports that we're now at about 13 million plus vaccinations in arm, right? At least almost 11 million have received their first dose. If you see the graphic chart down below, you can see the breakdown between Pfizer and Moderna, okay? Just so you know, in case someone is hearing for the first time, I was a participant in the Moderna coronavirus vaccine trial. I have been vaccinated since October. I got my first injection August 31st. I got my second injection October 2nd. Both Pfizer and Moderna have an interval in between the two injections. Pfizer's is 21 days, Moderna's is 28 days. But they are technically similar, meaning they have the same efficacy or effectiveness, and they have the same side effect or safety profile, okay? So when I start to describe side effects to you, I'm going to use myself as an example, as a part of this narrative, as well as using the millions of others and what has been reported. The Moderna vaccine trial that I participated in was roughly 30,000 Americans. The Pfizer trial was roughly 44,000 Americans. So before we could get to the point where the FDA, through emergency use authorization, could approve both of these mRNA, messenger RNA vaccines, listen, here's another point of truth so you can dispel misinformation. These are examples of the first messenger RNA vaccines to make it to market and to be approved. But it's not the first time that we knew about the science. We've learned about messenger RNA as far back as about 30 plus years ago. And cumulatively, through the years, most recently, because of outbreaks, related viruses in that SARS coronavirus family, respiratory viral infections or illnesses, MERS, in SARS. We learned so much. We learned about the spike protein. I'm going to talk about that when I tell you how these vaccines work. We learned that if you could attack the spike protein, that you would most likely be able to neutralize the infection. Okay, so when we were able to, we, meaning the scientific community, I say that a lot, when we were able to sequence in China first, sequence the genetic code of coronavirus in a matter of days. Pfizer, and in a matter of days, Moderna, working with the NIH, was able to design these messenger RNA vaccines. Why is that important? Because that quick amount of time is what contributed to the fact that we were able to have vaccines go through clinical trials in less than a year and be able to be approved on this preliminary basis. It's that. It's the science, folks. So when people say, I don't feel comfortable with the vaccine because the amount of time, I hear you. I hear you and I understand. But I also want you to know why we were able to do that. We didn't just discover this science. We've known about this science. We had a leg up. And because the science itself is unique, it is game changing. The science doesn't require us to grow viral proteins in a lab. The science doesn't require us to grow viral proteins in chickens or eggs. The science allows us to say, this is the genetic sequence of this virus. I can design a messenger RNA vaccine in the lab in a matter of days. That is mind-blowing. That allowed us to bring these vaccines to market sooner. Second thing that allowed us to bring these vaccines to market sooner, the fact that we had so much investment by the federal government into the process. And I hear we have all-time highs of skepticism and distrust of the federal government because of many of the reasons that I just explained. But this is an example of smart governmental action. Because the federal government invested in this process, $9.5 billion, drug companies were able to do something that they normally do sequentially, meaning they do one step first, then do a second step second. They were able to do them in parallel. They were able to test the actual vaccine candidate and have people like myself participate while manufacturing doses. If the federal government had not given that money, the drug companies would not have done it because it would not be a financial incentive. They would have lost money to work on manufacturing something before they knew whether or not it worked. So the federal government said, I'm going to remove the risk to you so you can only focus on the science and the logistics. Remember that, because that is important for the public to know as we create pressure and advocacy for other issues, other diseases, especially diseases important to Black and brown communities, for there to be priority around sickle cell, for there to be priority around HIV/AIDS, and finding answers and solutions. On average, this process can take 7+ years, but we did it in less than a year because of the type of science and because of the investment of the federal government. We did not cut corners. The science was rock solid, okay? We had scientists like Dr. Kizzmekia Corbett. If you have never heard about Dr. Kizzmekia Corbett, stop, Google her. She also goes by Dr. Kizzy. And look her up, a Black woman scientist, an immunologist and virologist who was a part of the team that designed this messenger RNA vaccine. And it's very important that I tell you that, right? Because of that historical legacy and the ongoing disparities that we face, because of the Tuskegees, because of the Henrietta Lacks, because of the Lucys, the Betsy's, the Anarchas, because of the Dr. Susan Moores, it is important that you know that we had people involved in this process who look like you and I. And even if you're not Black, or if you're not Latino, if you're not Indigenous, it is important that you know the power of diversity and the power of inclusivity, because we're all in this together. What is racism? I'll use Dr. Cameron Jones's definition. Racism is a system of structuring opportunity whereby one group is disadvantaged based on their phenotype, meaning their color, what they look like, their appearance, and a social construct of race. Another group is advantaged based on their phenotype and social constructs of race. But the whole society as a whole, we are impacted. Our strength is less. Racism makes us weaker as a nation. And we saw that in the insurrection in the Capitol. Okay, so I'm a public health physician. I'm a health equity doc. So I'm going to always spit it to you real. And I'm always going to talk about systems. And I'm always going to talk about things like that because they matter. Okay, a few more things that I want you to see before I minimize the slides. Okay, where have we gotten vaccines in arms? Okay, I told you, and you see here, this is an excerpt from Bloomberg. 31 million doses have been distributed. Those doses have been distributed means sent to the states. Those are the numbers that have been administered. Recall, it's about 1 million more than the CDC, because the CDC is off by a day, about a day and a half, and we're approaching about 1 million vaccinations a day. Look, I want to call out some states. Look at New Jersey, where I am. 51% of our shots have been used in New Jersey. But look at another state. Look at North Carolina, 32.6%. That disparity is what allows this nation to continue to be at risk. And, you know, and people will say, well, perhaps that disparity is due to some of the skepticism. Perhaps that disparity is due to the lack of trust, because public institutions haven't demonstrated trustworthiness at all times. But a lot of that disparity is because of a lack of logistical planning from the federal government to ensure that appropriate resources and staging resources in particular are in place in states and working with municipalities to effectively distribute the vaccine. So you see that uneven performance. I want to give you a few more examples of that. Look at, these are from Arizona to New Mexico. So New Mexico, 53%, Connecticut, 56.5, Oregon, 56.5, then a Minnesota, 39.8, a Washington, a 34.8. Look at Alabama, 29.3. That's a disparity associated with geographic region. Okay, and just one more. Look at Puerto Rico, only 33.4. I want you to also look at did we pass West Virginia? Let me go back. West Virginia, I want to call out West Virginia. West Virginia is doing the best, okay, among states. West Virginia has administered 73.4% of its vaccines. That's where we need to get to as a nation in order to establish herd immunity. What is herd immunity? Herd immunity is when we get to the critical mass of the population being vaccinated or having natural immunity, but we can't do natural immunity because that would be catastrophic. That would be genocide, meaning millions of people will potentially die. But herd immunity by vaccination means that a critical mass of the population is vaccinated, so it slows the spread of the virus. Because there will be certain people who can't be vaccinated, and I'll explain who those people are, or there will be people who get vaccinated and the vaccine won't be as effective. No vaccine is 100% effective. Pfizer and Moderna are practically 95% effective. Mind-blowing. Again, that is something we have not seen before with vaccines, and that is something that the messenger RNA vaccine has brought to the table. Okay, 94.5 and 95% effective rates. Okay, so it's very important that I show you this. But again, thinking through the lens of equity, how many Black Americans have received COVID vaccinations? Okay, so 16 states are tracking that data. One thing I need to point out, every state should be tracking that data. We should be tracking race and ethnicity. We should be tracking gender identity. We should be tracking region, just so we can see the different factors, whether someone lives in an urban area, a rural area, a metropolitan area, so we can see the factors that might be influencing or shaping the outcomes. So look at Mississippi, right? So you know, so far the vaccine is available to 1A and 1B, okay? 1A, healthcare workers. 1A, first responders. 1A, those seniors living in long-term care facilities and those working in long-term care facilities, right? But look at Mississippi. Look at the share of vaccinated who are Black, right? About 15%. But then look at the state residents who are Black, approaching almost 40%. Look at the health workers who were Black, also just shy of 40%. So there's a disparity there. So what is Mississippi doing to meet that disparity? Because as long as inequities are perpetuated, we will not be able to solve the disproportionate impact of coronavirus on historically excluded communities. So I just wanted you to see that. Okay, how do these vaccines work? Okay, I'm almost done with my slides. I smile because, one, I'm a public health scientist public health physician. Yeah, I'm a scientist too, but a public health physician, and I love the science. Okay, I'm passionate about public health. If you haven't, discerned that yet from today. But the way that these work, I heard a past director of the CDC describe it this way, and I think it's really cool. So I'm going to use it. Messenger RNA naturally occurs in your body. Okay, messenger RNA, ribonucleic acid, is not DNA. It is genetic material, but it's not DNA, okay? So if I make a big circle, and that's your cell, in the center of that cell is my fist, is the nucleus. In that nucleus is where your DNA lives, okay? That says who you are, okay, genetically. Outside of that nucleus, in the cytoplasm, so there's that sticky substance of the cell, is messenger RNA. Messenger RNA does not go into the nucleus. Messenger RNA has a genetic instruction that says make these proteins. So it tells the body to make enzymes that help catalyze reactions or to make proteins that are important to cell structure. That's what normally happens with messenger RNA. So what these vaccines did was mimic the properties of messenger RNA and said, if I take the genetic sequence of coronavirus, but not the entire thing, if I take the genetic sequence of the crown, you saw on that previous slide, it was a picture of coronavirus. It was a circle and it had this crown, right? Those are spike proteins on that coronavirus. If I take the genetic sequence that codes for the protein and I wrap it in fat, okay, so that's the lipid soluble substance, I inject it into your arm, we can use your body to do what your body normally does. It goes into the cell, not the nucleus, so it never changes your DNA. That's disinformation that people have spread. There's not a chip in the vaccine. That's disinformation that people have spread, okay? So I'm always going to check the disinformation and the misinformation so you can be informed, so you can check it when you hear it. So it goes into your cell, okay? In your cell, the body says, wow, here are some instructions. Snapchat. It's a Snapchat message, and that's what Dr. Frieden said. It's a Snapchat message. Why is it a Snapchat message? Because it's there in your body long enough for your body to say, oh, make this protein or make this aspect of the protein. The body starts making that protein, which is similar to the protein that occurs on coronavirus. Fact number 3, that's very important. You are not being injected with coronavirus, so you cannot get coronavirus from the vaccine. Let me say that again. You are not being injected with coronavirus, so you cannot get coronavirus from the vaccine, okay? You are being injected with an instruction sheet, a blueprint that tells your body to make certain aspects of the protein that are very similar to the spike protein. Your body makes multiple copies of this protein, starts to accumulate. The body says, what are all of these proteins that are not normally here? The body treats them as foreign and says, wow, let me mount an immune response. So the body begins to produce antibodies, your T cells and your B cells, and we won't get all into it. They start to get activated, okay? And they teach your body how to fight that protein, okay? So the instructions goes away. That's why it's a Snapchat. It gets degraded. It goes away. All right. Your body has these cells, these immune system cells, immune cells that stick around. They create memory so that if you are exposed to coronavirus, if you are exposed to the real thing, if you are exposed to the full complement, your body already knows how to fight it. That's how this vaccine works. That's it in a nutshell. That's the science that is so profound yet so simple. And that's what you feel. I saw that question. Someone had a question about, they wanted to know about the side effects, and I'm going to talk about that. But that's what you feel when you get injected. You feel your body working. You feel your immune system working, okay? This is very, 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 very important. So when we looked at the reported side effects of persons who participated in that first, I shouldn't say first, in the Pfizer vaccine trial, right, made it to phase 3. That's the phase I participated in Moderna. These are the reactions that most people got. These are side effects, okay? These are normal. These are to be expected. These are routine. I want to emphasize that. These are side effects. These are normal. These are to be expected, and these are routine. Okay. All right. So pain. Did anyone get their flu vaccine this season? Hopefully you did. Pain on injection site. Okay. All right. Redness. That can be common, but not as common as pain. Fatigue is common. Feeling tired. All right. Headache is common. All right. And muscle pain. So the things that are highlighted in green under any reaction: pain, fatigue, headache, muscle pain. That's mostly what people are going to experience. All right. The second dose, look at the difference. You still see 66.1% having pain. You still see a large amount of those who've been injected having fatigue. It actually goes higher. What we saw is that in younger persons, not necessarily in the older persons, but in younger persons, you had more side effects reported. Okay. So second injection, some people got chills. Also second injection, once again, you see muscle pain very high up there. Now, let me tell you my experience, and I see your questions. I'm going to get to them. Let me tell you my experience. When I got my first injection on August 31st, I did get headaches, okay? When I got my first injection, I did get pain at the injection site. What you see here, where it talks about mild, moderate, or severe, meaning mild, no interference with activity. Moderate, you might have to use like ibuprofen, which is Advil, or Tylenol, or Aleve to help you with the pain. And then severe, you may need to go to the hospital, or you may need to stop or alter your activity. When these side effects happen, they usually don't last longer than 1 to 2 days. In some cases, they're 3 days, but then they go away. Okay, so let's talk about risk. I told you that more than approximately 1 in 735 Black persons die from coronavirus. 1 in 595 Indigenous persons. 1 in 1,000 Latinos. Let's just center on those numbers, okay? I also showed you a chart that showed you hospitalization rates as high as 3 and 4% more for those groups. I also showed you a chart that showed infection rates anywhere about, it could be 2% or so higher for those groups, right? So the risk that you would be exposed to coronavirus, the risk that you would have to be hospitalized from coronavirus, the risk that you could get infected with coronavirus, that you could be left with a long-term side effect or adverse effect because of coronavirus, and the risk of death are all more than the risk of having an adverse reaction. I use a different word. You heard that. Side effects, normal. Side effects, common. Adverse reaction, that's what we're going to talk about. Who should not get injected. But first, I want you to see Moderna before we say that. Okay, so second. All right, this is Moderna. Reported side effects of the Moderna vaccine. Again, pain, it hurts. I don't know if you've had tetanus. Tetanus hurts, right? Tetanus hurts more than the flu. So I definitely got pain in my arm. It didn't stop me from going to work. It didn't stop me from raising my hands, okay? So 74% of people who got Moderna got pain in their arm. On the first injection, 90% got pain on the second injection. Approximately 39% of people who got Moderna got fatigue on the first injection. 8% almost got fatigue on the second injection. I had that experience. My second injection, I got it early in the morning. And by the end of the day, I could barely get out of my car. I felt exhausted. Okay. It took me about 20 minutes to get out of my car. By the next morning, I was able to go about my activities. I was doing a task force meeting for Essex County in Newark, right? So it didn't stop me. I had headache for about 2 or 3 days, okay? But never to the point where I had to go to the hospital, or never to the point where I couldn't do my activities on a consistent basis. So I think it's very, very important that we say that, okay? So now I'm going to stop sharing my screen so you can see me and we can have a conversation. All right, so I see some of the questions that people have begun to ask. Okay, so Cassandra Belton, I see that you asked, what side effects are expected after being administered the vaccine? those side effects that we just went through, okay? So the most common side effects, and again, side effects are normal. Side effects means that your immune system is working. Think about it this way. When you go to the gym, when you work out, when you lift weights, you are sore the day after. And it's not because you hurt yourself. You're sore because the muscle is working. The muscle is going through that expansion process, right? And that causes pain. Okay, so this is your body working out. The immune system is working out. Okay, so you feel pain. That means it's reactogenic. That's a word you might hear people say. This is a vaccine that's reactogenic. You get side effects from it. Okay, so you'll feel pain. You could get redness. You could get even swelling. That's what the majority of people all experience. You saw those rates, whether it was Pfizer or Moderna. The other thing, fever, but not as common. Not as common, but I have to say it because I hear people, they text me and say, hey, I got a fever. Am I okay? Yes. Fever can be expected. It is normal to get it after a vaccine. This vaccine, because it's reactogenic, it means your body is working. The immune system is working. Fatigue. So other than pain, fatigue is one of the most common symptoms. Most persons encounter fatigue, but none of these symptoms last so long that you can't return to your baseline. For me, like I said, the headaches lasted longer than the fatigue, and the headaches lasted about the same amount of time as the pain. For a couple of days, about 3 days. And then I took ibuprofen for it, occasionally Tylenol. I went to work every day. I never stopped doing my job. Some people feel very sick. They get fever and chills, but it's usually gone in 24 to 48 hours. Okay, that's the side effects. I see a question. Hi, Tanaye. I see a question about any insight to how likely the mutation will affect the effectiveness of the vaccine. Excellent question. So let's talk about the effectiveness of the vaccine again. All right. So I said earlier, and I want to mention this again, both Moderna and Pfizer are roughly 95% effective. What does that mean? That means when we mean the scientific community, no, Dr. Chris didn't run the study. Okay. When we were doing the late phase trials for both of these vaccine candidates, all right, you looked at the arm of people who got placebo, meaning just saline, and you looked at the arm of people who actually got the vaccine. When you looked at those two arms, the majority of cases of coronavirus were in the placebo arm. So in the vaccine arm, it was 95% effective at preventing it. It was almost 100% effective at preventing severe disease, okay? So that's what we're talking about when we say 94.5 and 95% effective. That is unheard of. I have to keep emphasizing that. That is a result of the messenger RNA technology, okay? Now, RNA viruses mutate, okay? Some of them mutate very frequently, and some of them don't mutate as much. For instance, an example, the flu virus. The flu virus mutates, and that's why every year you have to get a vaccine, and it's an educated scientific guess or estimate of which strain will be most prevalent in the community. Okay, so what about these mRNA vaccines? What we know so far, Tanya, is that the variants that we've seen, yes, they are more transmissible, meaning easier to spread from person to person. We don't know that they're necessarily more deadly, although a new variant has just emerged, and we need to do some more scientific study of it. But there is nothing to date to suggest that the vaccines won't work. Why? And Dr. Kizzy or Dr. Kiznikia Corbett, if you are on Twitter, please, please, please follow her. This is the Black woman scientist that I told you was a part of designing this. And it's important that I emphasize that. That social and cultural fluency is important. And so I love how she said it. So what you see happening is you get mutations along, right, the protein. Think about it, mutations along the spike protein. But it's not happening in such a way that the neutralizing antibodies can't bind. So where you might have a mutation, think about it in A, B, you don't have a mutation in C, D, E, or F. So the neutralizing antibodies can still bind. It's a polyclonal antibody response. Multiple types of antibodies, neutralizing antibodies, are generated by the body. And so to date, what the science is showing us, and Pfizer has gone back and has done additional research on this, and I believe Moderna has as well. They've taken some of those variants and they've tested the vaccine against it. You're covered. It works. Okay? So that's that question. You mentioned who shouldn't get the vaccine. The persons who should not get the vaccine is if you received the first dose of Pfizer or Moderna and you had a allergic reaction. An allergic reaction meaning you got hives, an allergic reaction meaning that your skin went red, an allergic reaction of the most severe type is anaphylaxis, life-threatening, meaning you can't breathe. Your throat swells up and a person can't breathe, okay? If that happens to you on the first injection, you should not get the second injection. All right, second group who should not get the vaccine. If you have known allergies to any of the ingredients of the vaccine, you should not get the vaccine. You shouldn't even get the first injection, okay? Ingredients in the vaccine, the messenger RNA itself, right? The instruction and the blueprints, okay? And polyethylene glycol, PEG, think about as the fat. That's what you put that messenger RNA in, because messenger RNA is unstable. And you want it to remain stable so it can get into the cells. It can take the instructions and tell the machinery in the cell cytoplasm, make protein. But if it breaks down before it can tell the cell to do that, it's not any good, okay? So that's why you have it in that polyethylene glycol. So there's messenger RNA in the vaccine. There are lipids or fats, is another word for fats, in the vaccine. There are salts in the vaccine. There are sugars in the vaccine. And all of that is around making the vaccine more stable, okay? There are differences in the Pfizer and the Moderna vaccines. I don't want to get into that today, but I can give you links about it. Pfizer, the cold chain, the pathway for Pfizer is more complex. It has to remain colder. Moderna doesn't have to be as cold as Pfizer. That's why Moderna can be at a doctor's office. Moderna can be at a pharmacy, okay? We have other vaccine candidates that are being worked on that won't have those same requirements around storage or handling that Pfizer and or Moderna have. Okay, Michelle, I'm reading yours, but you had drug and vaccine allergies. What should I do to make sure I'm safe when I take the vaccine? Okay, right. So you should have a conversation with your doctor, okay? You should definitely, even if it's not an immunologist, anyone you're under the care of, you should have a conversation with, because you need to know what specifically in those other vaccines that you took, what were you allergic to? What component of the vaccine were you allergic to? If you were allergic to the eggs, there aren't eggs in this vaccine. That's something else I get asked. People ask me, is the vaccine vegan? So there are no eggs in the vaccine. This is the messenger RNA, salts, sugars, and the lipids, okay? And so you can have food allergies and still get the vaccine. You can have allergies to other types of vaccines and still get this vaccine, as long as the ingredients in this vaccine are not the things that you are allergic to. When you get vaccinated, you should be vaccinated at a facility that has an EpiPen if you have a history of allergies, okay? Whether you have food allergies or whether you have allergies to vaccines, you should. That's part of the safety protocol, right? They have epinephrine on hand. Epinephrine is administered through the EpiPen, and that in particular prevents the anaphylaxis, that life-threatening closure of your throat. How do I get in line for the vaccine when I don't have a doctor? Okay, so 1A, 1B, and 1C. 1A, again, I'll just say in rough, the CDC comes out with these guidelines, right? And then it's really up to the states, Michelle. Each state can then specify which groups are eligible for the vaccine. So 1A, healthcare workers, first responders, 1A, people who work in funeral homes, 1A, people who live in long-term care facilities, people who work in long-term care facilities, 1B. 1B, the federal government changed because 1B originally was going to be 75 and older. Then the federal government made it 65 and older, which it should have done from the beginning. And it said you can be younger than 65, meaning you could be 16 to 64. And this is to your question. I saw Jay Petty's question, can children or toddlers be vaccinated? No. Pfizer study adolescents, and here's the different term I'm using. Pfizer study adolescents 16 and 17. So if you're 16 or 17, can you be vaccinated? Yes, with Pfizer. Moderna studied 18 and older. You cannot receive Moderna if you are younger than 18. You can receive Pfizer if you are 16 or 17 because the clinical trials, the late phase trials, specifically studied persons in those groups. Okay, and so Michelle, going back to you in 1B, we have people who have more chronic conditions. And so in that, the 16 to 64 group, chronic conditions like type 2 diabetes, COPD, chronic kidney disease, you have people with heart disease, you have people with certain immune conditions in certain states. Yes, right? I believe you might be in California, Michelle. Michelle and I went to Princeton together. I believe you might be in California. I'm actually disappointed with how California has rolled out the vaccine. And I'm hopeful that as we continue to have these health equity conversations and we have these allocation schema conversations, that we can be more aggressive in pushing the vaccine out, right? Because 1C gets into, the CDC differentiated between type 1 diabetes and type 2 diabetes, which I was actually surprised by. They didn't put type 1 diabetics in 1B. So there isn't consensus around some of the groupings, but it's my hope with this new administration and the impetus to vaccinate at least 1 million people a day. We'll need to do more. We need to get closer to 2 million people a day. That, Michelle, we will more rapidly progress, right? And so I would recommend, even if you don't have an immunologist, checking in with a doctor. If you can go and get a primary care physician, just so you can say, this is what my history is, or this is what my past has been. I've been allergic to these vaccines, and perhaps you know in which vaccines you were allergic to. Then you can look at the ingredients and see if any of those ingredients are the same. Okay. Does the vaccine affect the reproductive system? No. And I'm so glad you asked that question, Tracy, because this is something I heard in the early days, and I'm keeping check on time because I don't want to take all your afternoon. This is something I heard in the early days. The vaccine does not affect your fertility, one, because the vaccine does not go into what we call sex cells, your gonads that produce your reproductive organs. The vaccine also does not go into your DNA. I said that before, I want to say it again. Some things I want everyone to walk away with. There is no chip in the vaccine. The vaccine does not go into your DNA. The vaccine does not contain coronavirus, so it does not give you coronavirus. The side effects that you experience are normal and routine. You should expect to get some side effects. That doesn't mean everybody does, but you should expect. As much as almost 80% plus or 90% plus got pain. As much as 40 and 60% plus got fatigue. Okay, can you get fever and chills? Yes, you can. Don't get scared if you do. All right. There is a system called the Vaccine Adverse Event Reporting System. You can go onto this website and you can log any symptoms that you are experiencing after receiving the vaccine, because what the CDC will do and others will track what those symptoms are to ensure that something isn't happening that did not show up in the clinical trials. It's very important for me to say this. You had to produce, meaning the scientific community and the drug companies in particular, had to produce 2 months of safety data. So I got my last injection in October. You couldn't go before FDA for emergency use authorization without having at least 2 months of safety data. And you may say, that doesn't sound like a lot, Dr. Chris, but you got to understand vaccines. Most immune-mediated responses to vaccines happen in the first 6 weeks after administration. So if it doesn't happen in the first 6 weeks, it would be very, 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 very rare that it will happen. Okay? No, we don't know the long-term effects, but we feel confident because of what I just said, that most side effects, that we know what they are, and other adverse reactions are going to happen within the first 2 months. Okay, something else I hear people talk about. What about Bell's palsy? What about Guillain-Barré? What about death? In the late stage trials, you had to look at the vaccine arm and you had to look at the placebo arm. Those things happen regardless of whether or not you're involved in the vaccine trial. So what the researchers had to closely follow, there were redundancies around safety. I can tell you about it. I lived it. I had an app on my phone checking in with me about any symptoms I had. I had doctors reviewing my medical records. I have chronic health conditions. I have postural orthostatic tachycardia. I have vitamin B12 insufficiency, where I have to give myself injections for vitamin B12 every month to keep my body going. I have vitamin D insufficiency. And so with these chronic health conditions that I have, they had to make sure, one, I was stable enough to participate. So we know that people with chronic health conditions are safe. People with HIV/AIDS were a part of the trials. People with high blood pressure, diabetes, heart disease, they were a part of the trials. Moderna in particular, 17% of the persons in the trial had chronic health conditions and or obesity. 25% were 65 and older. Roughly 20% were Latino. Roughly 10% were Black or African American. In Pfizer, roughly 26% of the persons participating in the trial were Latino. Roughly 9.98% were Black. Those were very good numbers given how poor Blacks and Browns have been represented in clinical research in the past. They've been poorly represented because of those historical injustices. They've been poorly represented because of a lack of access. They've been poorly represented because of a lack of demonstration of trustworthiness, okay? The fact that we got to numbers that are almost parallel to the actual percentages of those groups in the general population made the scientific community feel very confident in saying this vaccine will work in the majority of Americans. Remember, it's 95% effective. So about 5% of people is not going to work. Something else I need to say, what we know about the vaccines is that it prevents illness or disease, and it definitely prevents severe disease. What we're still studying and still learning about the vaccines is, does it stop asymptomatic spread? Okay, meaning you can have coronavirus in your body and be infected with it, not know it, and spread it to someone else. The data is suggestive that it is. I can't say definitively because that was not an outcome of the study. They were not purposefully looking for that. But now they're going back and examining, all, because when you were part of the trial, I got my vaccination card. I will show this to y'all because, this is really a proud moment. I was near in tears when it was discovered, and there's no personal information on there, but really quickly, boom, that's my vaccination card. Everyone who gets vaccinated should have that. Okay. All right. What about medications that you're already taking? Yes, you can take your medications. Odessa, I take my medications. I take metoprolol. I take Midodrine. I take vitamin B12 injections. I take folic acid. I take vitamin D. There were people with diabetes in it, so they were able to take their diabetes medication. There were people with high blood pressure. They were able to take their high blood pressure medication. It was very important to test all of that during the late phase trials so that you could get the vaccine. Again, the only persons right now who are being told do not get the vaccine are people who develop an allergic reaction, not side effects, those are normal. People who develop an allergic reaction, whether it's just hives, redness, or the worst kind, anaphylaxis, meaning difficulty breathing because your throat is closing up, you should not get the second dose. Or people who have a known allergic reaction to ingredients in the vaccine. Those are the groups. Even breastfeeding and pregnant women are being recommended for the vaccine in consultation with their physician. You should go to your physician. You should have a discussion about it because it's a way of risks and benefits. I told you how more likely Black and brown people are to be exposed because of where they work and where they live. I told you how more likely Black and brown people are to be hospitalized because of those issues of systemic racism impacting where they work, where they live, in late stage of not having access to testing. I told you about the story of my cousin, right? Being more severe at presentation. The story of Dr. Susan Moore, your symptoms not being validated, heard, or believed. All of those factors contribute to why we see those disproportionate outcomes. So consider that, this wait and see approach that a lot of people are doing. I hear you, I understand you, but I want you to be informed. I want you to know that the more you wait, there are risks associated with waiting, and the risks associated with waiting are higher than the risk associated with an adverse reaction. Remember, side effects are normal, and the risk associated with the adverse reaction. An adverse reaction, what the CDC did and I wrote this number down because it's just so impressive. This is how rare it is. The CDC, across the first 2 weeks that Pfizer was available, tracked this. There were 21 cases of anaphylaxis after 1.89 million doses have been given. So ultimately, that means there are about 11.1 cases per million. And most, if not all, of those persons had those symptoms within the 15 to 30 minutes. That's why we make you wait that long after you get vaccinated, and all of them recovered. Okay? Can you choose which vaccine? No, you can't. There is no difference. They are technically the same. The differences are associated with the storage and the handling. So when the vaccine makes its way to you and you have an appointment, get whatever vaccine is available, because both have the same level of effectiveness and both have the same level of safety. All right. What about women who breastfeed? Yes, you can. I just explained that. Dina Valerie says, if you're allergic to ACE inhibitors, can you still get it? Yes. The only reason you cannot get it, Valerie, if there is an ingredient that's in ACE inhibitors that's causing your allergy, that's also in the vaccine, which I haven't looked at your particular ACE inhibitor to compare it. But again, the things in the vaccine are the messenger RNA, salts, sugars, and lipids. That polyethylene glycol is what we think is driving the adverse reactions. So if you have polyethylene glycol and anything else, polyethylene glycol stabilizes the messenger RNA. That's what would drive it. Otherwise, this is where you have a conversation with your doctor and you should be vaccinated. Jackie says, what is the difference between Johnson & Johnson versus other ones outside of it being one shot instead of two? Okay, it's not a messenger RNA. It's not this newer, not new, but newer technology, meaning at least a decade's worth of science has gone into it. So vaccines can use viral vectors, meaning using another virus in a weakened or attenuated state to get the proteins into the cell so then you can invoke an immune response. That's AstraZeneca. Or Johnson & Johnson similarly uses a viral vector. It does not use messenger RNA. So we're poised. We want to see what the efficacy and the safety profile is going to be about Johnson & Johnson, Jackie, because if it is, the CDC said it had to be at least 50%. So if it's above 50%, that's going to be very important because that's one dose. Okay. How long after the vaccine are you protected? Excellent question. All right. So what we know from the science is roughly you're about 50% protected after the first injection. After the second injection, that number begins to approach that 95% effective, but you really need to give yourself several weeks on the outside of your second injection. So I tell people, think about a month after your second injection, then you should have full protection. Okay. Do you still need to social distance? Yes. Do you still need to wear a mask? Yes. Why? Because 5% of people the vaccine won't be effective in, because there will be people who cannot get the vaccine because of those two scenarios I described, and because we're still learning if the vaccines prevent asymptomatic spread. We believe it does, but we can't say definitively until we demonstrate that through science. Okay. All right. If you have taken the vaccine and after 72 hours nothing occurred, is it safe to say there won't be an allergic reaction? Yes. For most parts, yes, Valerie. Because those allergic reactions, these are not side effects. Again, I have to say this again. Side effects: fever. Side effects: pain. Side effects: fatigue. Side effects: muscle pain, joint pain. Side effects: chills. Side effects: congestion. Side effects: diarrhea. Those are normal and routine because the vaccine is reactogenic. Flu is also a reactogenic vaccine, and because it is, people are like, it gave me the flu. It did not give you the flu. Okay, Dr. Chris is telling you today. I got my serious face on. It did not give you the flu. Okay, it's reactogenic, so your immune system is working, and you sense those symptoms. So it would be rare, Valerie, for you to have an allergic reaction outside of 72 hours. But if you have a history of having allergic reactions, you would most likely have an EpiPen or you would most likely have had a conversation with your doctor about what you should do in the instance that you start to develop hives or you start to have a scratchy or itchy throat. So it would be very unlikely. Amber says, if you've already had COVID, is it necessary to get vaccine? Yes, yes, yes. Excellent. Thank you, Amber, for asking that question. Why? It's important because we don't know how long immunity lasts, Amber. What we know from natural immunity, meaning a person who got coronavirus, okay, it is very rare to be infected with coronavirus twice. It is almost nil that you will be infected with coronavirus 90 days after being infected the first time. So we know that immunity lasts at least 90 days, okay? After 90 days, we can't definitively say how long you have immunity. Because of that, you should get the vaccine. Okay, so that's a fact that you all have to know and you have to take with you. If you have coronavirus, you should get the vaccine. And you might be saying to me, well, why? Okay, one, reinfection, although rare, has occurred. And what if you are an asymptomatic carrier? What if you get infected with a different strain, which has happened, and you pass the infection on to someone else? And you pass the infection on to someone else, like my dad, who had a host of chronic conditions. My father had COPD. My father had end-stage lymphoma. My father had HIV/AIDS. I've spoken about this before. And so that made it harder for him to fight the infection. So I say this to people all the time. You might get exposed and get infected and nothing happens, but someone else can get exposed and get infected and lose their life. Another person can get exposed and get affected and have a long hauler syndrome like my sister Kim. And I don't want anyone to have that. 395,000 Americans are gone. And that number is going to continue to rise, right? Because we still haven't seen the surge from all of the holiday travel. We're just in the midst of it. And now we're seeing these variants that make it easier to spread. Okay, I think I have answered all the questions. I have someone working with me today. Celiac, is it okay to take? Yes. If the flu vaccine gave me the flu, it did not give you the flu. What the flu vaccine did is the flu vaccine is reactogenic. The flu vaccine gave you side effects, which is normal. And those side effects are also like the same things you experience with the flu, but it's not the flu. Okay? So, yes, you should continue to take the flu vaccine and you should get coronavirus because there is no coronavirus in the coronavirus vaccines. It's not a killed coronavirus. It's not a weakened coronavirus. It's instructions to create a protein that's like the protein in coronavirus. That protein is not able to infect you, but that protein is so important that the body builds up an immune response and says, I'm ready to fight. It's basically what it does. It's like, bet, I'm ready to fight. So the body builds up all of these B cells, T cells, and so that if you get exposed to coronavirus, you are ready to take it out, to neutralize it. Will this vaccine protect us from the second strain? Yes, I mentioned this. All research today, and this is still evolving. So I want you all to follow the science as the science is happening. If somebody tells you that they know 100%, that person is not speaking the truth. We only know what the science has told us until this point. And what the science has told us to this point is that this will cover those strains that are currently being discovered because it is a what? Polyclonal antibody response, meaning that you have multiple types of neutralizing antibodies that can bind that spike protein and get rid of it. Okay, that's why. And Pfizer went back and specifically tested its vaccine on the variants that were being described in the UK. And that's what the pharmaceutical companies are going to continue to do. The pharmaceutical companies are also going to begin to evaluate the vaccine in younger and younger populations, right? So they'll take just the next step down so that we can begin to vaccinate younger groups. I will continue to be followed. I will be followed for a total of 2 years to ensure that there are no long-term effects. We have nothing in the literature to date to suggest that there will be long-term effects because, like I explained, most immune-mediated effects of vaccines happen in the first 6 weeks to 2 months after being administered it. Will I have to get the COVID vaccine next year? I don't know yet. We don't know yet. We don't know. There is science that suggests that the immunity could be long-term. but we haven't proven that. And so what Moderna is starting to do is people first started to get injected with Moderna in March, right? So people are going to come up very shortly for 1 year. So Moderna is going to study people and give them a booster and compare what type of immune response your body has at that year point, and how does a booster improve that immune response, or if it's necessary. So we're going to do additional research. So we'll have a definitive answer as that research gets done. I think I have answered everything. And I really, really, really thank you all for tuning in. I don't want to take up too much more of your time. I hope that you left today with a greater sense of peace and reassurance. Maybe you're not ready to get vaccinated, but we can keep having this conversation. And the more we have this conversation, the more your questions will be answered. And the more your questions will be answered, you will be able to operate in your self-efficacy, the ability to make an informed choice or decision. I emphatically believe this vaccine is safe. I emphatically believe this vaccine is effective. I've had at least one, my brother, Bishop Purnell, his wife, Apostle Pasha Purnell, people who are near and dear to me, I've strongly encouraged to get vaccinated, and they did. My aunt, who is 83 years old, got her first vaccination on Saturday. My brother-in-law, who works also at a healthcare system, got vaccinated. My sister and my cousins are scheduled to get vaccinated in the next coming weeks and days. Friends, church members, my church family, Behashem Yahweh, shout out to Behashem Yahweh and Yah Squad, are scheduled to get vaccinated. It was so important, I have to end with this. I'm authentic and I'm transparent. And it was so important for me, being a public health physician, being a Black woman, losing my father, having my sister be a long hauler, losing two cousins. It was so important for me to walk the walk. Everybody didn't participate in the coronavirus vaccine trial, and I didn't expect everybody to, but it was something I felt deep in my heart and my spirit that I should do. It was something I felt I was able to do. And because of the abuses of Tuskegee, because of what happened to Henrietta Lacks and those enslaved Black women who were robbed, pillaged, and abused and taken advantage of, because of what's happened to Dr. Susan Moore, I wanted to be on the front lines. I studied and went through the research and the literature and said, no, they didn't cut corners. Yes, informed consent is being upheld. I know it's voluntary. I can remove myself at any point. And I have scientists following up. When I say they followed up with me, I hurt my back during the trial. I hurt my back the worst I've ever hurt it before, because I was doing work at the hospital. And they looked at my medications. They sent it all the way to Texas. Texas is where Moderna is stationed out of. And not only did the local docs in charge of the study in Newark, New Jersey, but the top docs, they want to make sure that this person didn't develop this because of the vaccine, and the medicine that the person is on won't change how their immune system functions to such a point that it won't be an accurate assessment of whether or not the vaccine prevented the disease. And so there were so many checks and balances built in, because of the concerns of the historical injustices. We had groups like the National Medical Association, Black physicians, Black physician scientists, who too wanted to pour over the data. You had so many people pouring into this process because of the uneven federal response, because of systemic racism, because of the historical injustices, because of all of those truths. You had people step up to the plate and say, I want to ensure that this is safe and effective and that we can communicate this to our community. And that's what I've enlisted myself to become a part of. So I thank you for joining Life Clinic with Dr. Chris. We will do this again. Shout out to my dad in heaven. Thank you for leading the way, Big Tim. And, prayers to all of the families that have been impacted, who have lost loved ones, or who have people who are struggling to recover. Prayers for those of you your lives may have been economically devastated. Prayers to those of you who may have lost their job, Prayers to those of you suffering from isolation or depression because of the lack of social connectedness and cohesion, all those things that we know are important. We're going to continue to fight. Those of us who believe in health equity, we are not going to be silent. You have my word. You know I won't be silent. You see me use my big mouth. But I will not be silent, and so many others will not be silent, and you won't be silent. There are Fannie Lou Hamers, and each of you will rise up, will swell up and say, we need the truth, we need the facts, we need the data. So as I say, Daddy, not only am I following the science, not only am I following the data, I've become it. I'm a data point. So rest in the fact that I went through it so that you would be able to go through it. Shalom and agape. I love you all. Stay tuned. Again, look for me on Twitter at Dr. Chris MD. Look for me on Instagram, The Good Doctor MD. Look for me on Facebook, Life Clinic. Like the page. Ask other people to like the page. If you want me to do more of this, if you have other questions that I didn't answer, put them on the page. We will go through them and make sure you get the information you need. Love you. This has been The Good Doctor MD. Have a blessed day.